A significant step towards strengthening adolescent healthcare in Saint Lucia unfolded on Wednesday, December 10, 2025, as the Ministry of Health, Wellness and Elderly Affairs, in collaboration with several key development partners, launched a national training initiative for healthcare providers. The training focused on the implementation of national standards for quality healthcare services for adolescents, a crucial framework designed to ensure that young people across the island receive care that is safe, confidential, evidence-based, and responsive to their unique needs. The training sessions were hosted in collaboration with UN Women, the United Nations Population Fund (UNFPA), and the Build Back Equal project. A specialist for sexual reproductive health and reproductive health commodity security with the UNFPA says the newly adopted standards in the framework ensures that adolescents receive consistent, rights-based and developmentally appropriate care.
These standards represent a practical and strategic step forward in ensuring that adolescents receive the quality care that they need and deserve. It is also worth noting that the Ministry of Health has established the SRE Technical Working Group to strengthen the coordination of sexual and reproductive health interventions across the island. This kind of leadership is critical to ensuring that the standards are not only adopted, but effectively implemented.
Dr. Tonya Frame, a consultant with the United Nations Population Fund (UNFPA), explained that the standards are aligned with the World Health Organization's quality standards for adolescent healthcare services and cover a wide range of health services tailored specifically to the needs of young people.
There are 8 standards, and they're really looking at the first standard, for example, is around health literacy, adolescent health literacy, ensuring that adolescents have adequate knowledge and information, know where to go to access services, they can understand the information that is shared with them. But a big part of this training is ensuring that providers have the competence to engage adolescents in a way that is age appropriate, but also culturally appropriate. I know that's a difficult kind of concept to marry, but yes, it is. It does have to be culturally appropriate in terms of the laws of Saint Lucia and so forth.
Sexual and reproductive health nurse at the Viewfort Wellness Center, Junette Joseph, believes the training directly addresses long-standing gaps in accessibility and inclusiveness of adolescents within the current system.
This training is important because our adolescents have been sidelined a bit or neglected, for lack of a better word, in the services that we provided. So although the services are available, they're not accessible by them, and also our policies. This training will also help guide our policies to change, to include them, to become more inclusive, and to help us provide better care for the adolescents.
The training initiative also supports the ministry's broader goals of reducing barriers to care, promoting healthier lifestyles, and fostering a supportive healthcare system for future generations. From the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Onika McCoy reporting.